Hi, I'm Dr. Erin Wells from Mountain Ears Hearing Clinic, and I just wanted to give everyone a few tips on what's going to happen during your child's hearing evaluation. So typically with birth to 3, what they're looking for is the auditory function of the child, because they want to know if they have any hearing issues, and they want to know if they have hearing issues, is that going to affect their speech development or prohibit them from doing any speech therapy. So generally at the appointment, what we're looking for is just to make sure that the child is able to hear normal speech, be able to function in a day-to-day situation. And the first thing I do is I go over a little bit of case history with the parents or the guardians and just see if there's been any recurrent ear infections, if there's any family history of hearing loss, see if the family actually has concerns about hearing, and see if they passed their newborn hearing test or had any recent hearing tests. So the first thing we're going to do is I would check the child's ears. And this is an otoscope. I know they have this at every doctor's office and they check the child's ears, but we're just looking for any earwax, anything keeping the sound from going into their ears. And it's really a tricky situation with a lot of kids because some of them aren't really sure about me or the person they're seeing, and they don't really want their ears touched. So depending on the age, some kids are not so happy about that, and some of them are completely fine. But my job is try to make them feel comfortable and get the most information we can. So we check their ears for wax, and then we do the test over here. And it's just a little soft tip that goes inside of their ear. And what it does is it checks their eardrums and makes sure that they're moving correctly. So we wanted to use this test to check for fluid or anything mechanical going on with the ears. And then the other test that we try to do, if they can be still and quiet, we're going to do what's called otoacoustic emissions. And this is another little soft tip that's going to go in their ears. And it plays different sounds. So I usually tell them you're going to listen to music. And if they can be still and quiet, it checks all those different pitches and checks the nerve function inside the ears. Now, if I have a child that's not able to be still and quiet, we're going to come into this room. And this is my sound booth, and what I would do is I would have the parent sit here. They're basically going to be a chair, and they are going to hold the child facing forward, and there's different light up toys. So I have a little remote control that's going to light up some toys, and we try to condition them to turn to those sounds. So whether it be my voice, or sometimes children are able to do the tones as well. Instead of them raising their hand or saying that they hear something, they do that in response with their head turns. So this is another way for us to verify if the child is able to hear appropriately for speech development. So at the end of the appointment, I just go over the results with the parents and make sure they understand what's going on, whether we have any concerns or not. And then I send a report over to birth to 3, and they kind of continue the care from there. So that would be what we do for a hearing evaluation with any of the kids. Thank you.